So cardiovascular. The objectives for this and the next couple lectures are going to be pretty similar. We want to summarize the cardiovascular adaptations to aerobic training and describe or explain the benefits of these trainings, okay? So we want to summarize and then explain. All right, so when you think of the cardiovascular system, there's a lot of different pieces and components to it. But as I talked about in class a couple days ago, the cardiovascular system doesn't do a whole lot. And what I mean by that is that there are very few variables it actually changes. So think about your heart. There's really two things that it can do. It can either pump harder or slower or softer, and then it can beat faster or slower. Now we can change some of this components. You know, if we have a bigger heart, we can pump more blood, that sort of thing. But ultimately, all we're changing or doing things that will change how much blood can come out of the heart and how fast it beats. Okay, and so as a result, adaptations are pretty limited. Heart size, which will really tie into stroke volume, so these two kind of go together. You got heart rate, and then you could look at it, well, these three or four go together because heart rate, stroke volume make up cardiac output, and then we can also make changes to blood flow and blood volume. So we're going to go in this order, so let's start off with heart size. Okay, now look at this picture here. This is what happens to your heart due to endurance training. So there's two things that happen. Okay, first, our cardiac muscle mass increases, but what's important is that we get this left ventricular hypertrophy, so we increase muscle size. Now, in order for this to happen, the chamber size actually increases. So notice that the chamber size on the right is greater than that on the left. The other thing that's important to know, and I don't have a bullet point for this, is that the thickness of the heart wall increases. Now, it doesn't increase dramatically, and more importantly, it doesn't increase inside the ventricular chamber. Okay, so there are some heart diseases where the muscle, the cardiac muscle thickens, but what happens is that the wall comes out here, right? And this is a little dramatic, and so this is all wall, and then you've only got this much space for blood to come in. That's less than ideal. Now, as a result of this increase in heart size, what happens is we have a greater filling time. Okay, our preload increases. This is due to increased filling time, and the way we increase filling time is by reducing heart rate. Now, this is called eccentric hypertrophy, and so we get increased volume, okay? Increased volume of the space, and one of the things that happen is that, or one of the reasons that this might occur is just because our plasma volume's increased, okay? And we've talked a little bit about that, and we'll get into that later. But if I've got more blood, my heart's going to get bigger. One of the things it can do is get bigger to accommodate that, and they can do this via myocardial compliance. Now, hopefully you remember, compliance and elasticity are opposites. Okay, a rubber band is elastic. It likes being in its original form. It doesn't like stretching it out, even though we talk about how it's stretchy. A paper bag, on the other hand, that's compliant. It's okay being stretched out. All right, it's okay. It's a good thing if we have some compliance. Now, we don't want too much, because if it's too much, that just means we can fill up the heart, but it's going to make it more difficult to get the blood out. And so with this eccentric hypertrophy, the compliance of the heart decreases so that it's easier to get blood in. But we also have this concentric hypertrophy, and that was that muscle wall thickening that I was talking about a minute ago. And what's happening here is we're getting more actin and myosin. That's great. More actin, more myosin equals more cross bridges equals more force equals greater stroke volume equals greater cardiac output, and or we'll have the same cardiac output at a lower heart rate. So if we look at what happens with stroke volume, notice that pre-training and post-training, there's a big difference. Okay, for a given workload, training causes an increase in stroke volume. But notice in the untrained individuals, we reach a plateau. Okay, or they reach a plateau. We're all trained here, so we're going to talk about the people that are untrained. Whereas that doesn't necessarily happen in trained individuals until a much higher intensity. Eventually you get to the point where your heart's beating so fast that it's hard to increase stroke volume. Okay, and so as a result, endurance training increases stroke volume, and this is a great thing. It makes your heart more efficient, and there are 3 reasons why this happens. You've got more blood, your ventricle can hold more blood, and your heart is able to contract at a higher, with a greater force. And so as a result, look at what happens to heart rate. So for a given intensity, heart rate is lower. Okay, red is post-training, blue is pre-training. And so as we go, notice that in all intensities or all speeds, heart rate is lower for the post-training. Now it is possible, and we'll get into this in just a second, we're not completely sure why, but notice that the max heart rate is slightly lower in the trained individual compared to the untrained. All right, and so this happens because, remember, we're trying to maintain cardiac output. Heart doesn't care, or brain doesn't care, body doesn't care about stroke volume, doesn't care about heart rate. It's all about oxygen delivery, and that really is directly tied to cardiac output. Okay, and so we have greater stroke volume. We decrease the intrinsic stimulation. Okay, so we basically, the SA node kind of relaxes, I guess you could say, and it's not so anxious to fire. And as a result, we have a lower heart rate for a given intensity. And as I said earlier, we might actually have a reduced heart rate, maximum heart rate. This leads us into heart rate recovery. And so we talked today actually about oxygen, or EPOC. Excess post-exercise oxygen consumption. Notice, how our breathing and our heart rate and all that's elevated even after we stop exercising. Now notice the difference between these two figures. Again, blue is before training, red is after training. So we've got a 4-minute exercise bout, pretty intense actually if we're getting up to a heart rate of about 200. And it's important to know that these heart rates are very similar, but look at the differences between the two types of training with heart rate recovery. Okay, and what I mean by that is look at how much more quickly the trained individual gets their heart rate back to normal compared to the untrained individual. Okay, and so this is termed heart rate recovery. And just simply put, how long does it take your heart rate to get to normal? Training allows this or causes this to get back to normal more quickly. It's actually one of my favorite features that when I remember to look at on my Apple Watch, it gives you a screen that looks something like this. But it's multifactorial, right? So we talked about how one of the things that can cause the EPOC is high core temperature, high sympathetic activity. So this will delay it a little bit. That's why we don't go just from, I'm going to go back to this picture here. That's why we don't go from 200 to 50 like in a minute. Okay, it doesn't go like this. There's a little bit of a delay. All right, so then cardiac output has no effect on cardiac output at submax. Remember, the oxygen cost of exercise is the same regardless of whether or not you're trained or untrained. Yes, stroke volume increases, but heart rate decreases to offset that. However, maximum cardiac output increases, and this is due to the fact that our stroke volume increases, or max stroke volume increases. Heart rate and heart rate max don't really play a large role in this increased cardiac output, and as we said a few minutes ago, max heart rate might actually decrease a little bit. This is arguably the most significant adaptation to aerobic training, that your maximum cardiac output increases. And so we see that with this figure here. Okay, so again, blue is before, red is after training. Look at cardiac output. Okay, so with this study, max cardiac output was 20, but after training it was 28. And as a result, this person was able to run faster or at a higher intensity. Okay, so 17, 18 kilometers an hour versus close to 22. We're going to finish off by talking about blood flow. Okay, so exercise increases blood flow. All right, I know this is nothing new. And so if we want to take advantage of this or make this blood flow more efficient, well, what's the purpose of blood flow? It's to deliver oxygen. And so if we want to maximize or make that as efficient as possible, there's a bunch of things we can do. We can create more capillaries. We can recruit more capillaries. We can do a better job of distributing the blood to where it needs to go. And we can also have greater blood volume. Any or all of these things are going to make it easier for muscles to take up oxygen. Okay, and so what happens with endurance training? Well, it increases capillary density. Okay, more capillaries means that oxygen's getting into the cell in more places, and that as a result, oxygen's going to be closer to the cell, closer to each cell, closer to mitochondria. We also increase our ability to recruit capillaries. We talked a little bit about this several weeks ago, where we talked about how the lungs don't have every capillary recruited when we're at rest, okay, due to pressure gradients and that sort of thing. Well, now with endurance training, it's easier to recruit these capillaries. And so what's the benefit? We can deliver and take up more oxygen. If I can take up more oxygen, I can use more oxygen. If I can use more oxygen, I can go further or higher, or whatever you want to take it, or however you want to consider it. But my aerobic performance will be much better. And so blood flow redistribution. So we can get blood to the muscles and minimize where else it goes. I'll have more oxygen to be taken up by the muscles. Okay. And there's some evidence to suggest we actually get really good at taking blood or sending blood to the oxidative muscles as opposed to the glycolytic muscles. All right. Last thing, blood volume. Okay. Aerobic training causes us to have a greater blood volume. Okay. This happens two ways. One, we increase plasma volume. So notice that we go from 2.8 to 3.3. Okay. But we also increase the number of red blood cells. So we go from 2.2 to 2.4. Now, yes, our hematocrit might drop a little bit, but if I've got more blood cells packed into my blood, that's going to allow me to carry more oxygen. Okay, so if we just increase the concentration of hemoglobin by 1 gram of hemoglobin per deciliter of blood, okay, that increases our oxygen carrying capacity by 5 to 7%. Okay, that is a huge amount. Okay, just think, I pick on Leroy or talk about Leroy all the time. If I told him, hey, you're going to be able to deliver and take up 5% more oxygen than normal because of training, okay, that 4-minute mile that he was, that he's close to, that it's not this simple, but we could take that 4-minute mile and that becomes 3:48. Okay, 12 seconds off, that's a 5% increase in performance from a 4-minute mile. Okay, and then he'd be getting paid. So that is all the cardiovascular adaptations. In case you have listened to this entire video, I've got a question for you, and I want you to answer. And if you answer, I'll give you a couple points of extra credit on exam 4. Okay, so what I need to know is, would you prefer this video had been 1 or 2? That's it. You can even just send me an email that says 1 or 2. I'll know what you're talking about. So there you go. Please do keep this to yourself. I just want to see how many people are actually watching this. Thanks.